Stacked in hallways to make more room. Patients being treated in every available space. 5 Investigates first showed you this video shot by an MGH staffer inside the emergency department last month. And new numbers show this capacity crisis is not easing.
Dr. Ali Raja, the Deputy Chair of the Department of Emergency Medicine at Mass General, joins us in the studio today. Great to see you. Thanks for coming in.
Thanks, Ben.
All right, let's show you some of these numbers that I know you're familiar with. For the viewers at home, 26 out of the 31 days in January, MGH was in what it calls a capacity disaster. That's when the day starts with more than 45 patients without hospital beds. Today alone by noon, 63 patients were waiting for beds. I can't imagine how you manage that. Where do you begin?
It's so tight. You know, the fact is we only have 77 beds in the emergency department. And so when we've got 45, 50, 60 patients waiting for beds, what that means is for any new patients coming in, we only have a handful of places to actually treat them.
A dozen or so beds.
A dozen or so beds.
Okay, well, I mean, so what do you want patients to know in terms of coming somewhere, you know, because they feel they need treatment? When should you really be going to the emergency room, considering there's this capacity crisis?
Well, that's a great question, Erica. The first and most important thing is if you have an emergency, heart attack, stroke, gunshot wound, car accident, we are still going to treat you immediately and get you to the right place. Fortunately, the patients who are waiting for hospital beds are healthy enough that they can wait. They're getting antibiotics, they're waiting for a non-emergent surgery. They can wait to go upstairs to the hospital, and oftentimes they do have to wait a few hours. But if there's an emergency, any hospital in the state, especially Mass General, we can treat you right now. Don't let this stop you from coming to us.
All right, so MGH is now asking the state for permission to add about 100 new beds.
Right.
So talk a little bit more about that. What type of beds are these? And even if they are approved, they're still several years away. The building hasn't even been built yet.
All right, so Ben, we're building a new building and we have room for 100 new beds in it, and we're working with the state to see if they'll get those approved. Those would allow us to take the patients who are currently waiting for beds downstairs in the emergency department to go upstairs and get treatment started faster for them. Now, as you mentioned, though, that's still 3 years away. So at the same time, we're doing a lot internally. We're revamping the processes of our emergency department, looking at the flow of patients through it. We're also using our home hospital service. So we're getting patients home instead of admitting them to the hospital. We're doing that for 30 to 40 patients every day right now.
Yeah. Well, we'd be remiss if we didn't talk about the Steward healthcare problems. We've been reporting on it for weeks. The idea that maybe hospitals could be closing. I mean, that would, I would imagine, have a terrible impact on all of this.
It probably would, Erica. The fact is that, you know, our main concern is always going to be the patients who come into us, but I really do hope that patients across the state can continue to have access to the care that they need in the neighborhoods in which they live.
And before you go, because I know you see this firsthand, I just want to ask you, we've talked to Dr. Kiritskis over at the Brigham a lot about infectious diseases. What are you seeing? I know we're still only in February. He was hopeful that maybe we're on the tail end of the flu virus season. Is that what you're seeing as well?
I'm seeing that too, Ben. The COVID numbers seem like they're going down. The flu numbers look like they may have peaked. I think that we're going to be seeing the end of this over the next coming